While many aspects of society are emerging from the COVID-19 pandemic, the battle with substance abuse disorder rages on for thousands of Mainers. According to the Attorney General's office, 504 Mainers died from an overdose last year, a more than 30% increase from the previous year. And that troubling trend continues. From January to August of this year, 399 people died from drug overdoses, and more than 80% of the cases involved opioids. While experts say the ongoing isolation, lack of access to treatment, and stigma are fueling the crisis, a statewide initiative is helping break down barriers to recovery and save lives. News Center Maine's Vivian Lee has the story from Oxford County.
Working out of an office inside Oxford County Mental Health Services, Glenn Gordon checks messages and looks over his supply of overdose reversing medication, naloxone. Glenn is a certified alcohol and drug counselor for the overdose prevention through intensive outreach in naloxone and safety or options program. He is the first person to get a call from law enforcement following an overdose in Oxford County. He meets with patients in crisis and passes out these packets with information on recovery and mental health services, housing and job programs. In some cases, though, people aren't ready for treatment.
We don't judge you. There's no stigma here. We're here when you're ready. We'll talk about what you want to talk about. We'll point you in a direction you want to go. This isn't about us, it's about you.
Glenn knows the struggle to get sober well. He started using drugs and alcohol as a teenager. After spending time in jail, he got clean with the help of a 12-step program. He relapsed 17 and a half years later.
I ended up homeless. I didn't have a place to live. I lost my job.
Now in active recovery himself, Glenn has about 120 people on his caseload. As part of a statewide initiative launched earlier this year, there are outreach counselors in nearly all 16 counties. Oxford County has seen more than a dozen overdose deaths this year. Authorities say a spike in the use of dangerous drugs, including fentanyl, isolation, and lack of treatment options during the pandemic are playing a role. Rumford Police Chief Tony Milligan says before having an options liaison like Glenn, there was no follow-up with patients in crisis.
Now there's an expert, somebody who's qualified in knowing how to help these people, what resources are available, not just in this community, but throughout the state that we never had access to.
Smaller hospitals like Stevens Memorial in Norway can refer patients for mental health treatment, methadone-assisted therapy, and other services. But many are falling through the cracks because the closest inpatient detox centers are located in Lewiston and Portland. Christina Booth is a nurse director for emergency services. She says nurses pass out the options packets, and Glenn connecting with patients for follow-up services is filling a critical need.
After they'd done the critical sort of detox segment, that he was able to help them get into, recovery programs.
Glenn also refers patients in crisis to recovery coaches like Kari Taylor. Taylor relapsed into drug and alcohol use 4 years ago after struggling with addiction as a young adult. As a project coordinator for Project Save Me for the Western Maine Addiction Recovery Initiative, she's recruiting people in recovery to support others who need help.
One of the best ways to hang on to your recovery is to help other people. And so the act of reaching out and helping people that are struggling just is, it's an amazing feeling.
The initiative, which was launched with federal funds, is expected to be funded through next year.
If we can keep it going, is look at how do people look 3 months, 6 months, 2 years from now. That's how we'll gauge the success of this program.
To help people living with substance use disorder stay on the right track to sobriety. In Rumford, Vivian Lee, News Center, Maine.
And if you or someone you know is struggling with alcohol or drug use, you can get help by calling 211. We'll also have more information on addiction treatment and services on our website and mobile app.